Mr. Speaker, Mr. President Pro Tem, and the members of the Vermont Legislature. It's really a great honor and privilege to stand before you to embark on the same journey with you to see how we can improve the healthcare in Vermont. I want to make clear what I'm going to present is a team effort. I have a team of more than 20 people to do the analysis and to examine different alternatives. And then we're trying to recommend the best alternative to you. I know what I'm going to present is not necessarily popular for everyone. Recently, I was talking to an insurance executive, and I asked him, are you in favor of spending $50 billion to manufacture a new shuttle to the moon? And he says, yes, if you will go. I'm going to be boring you, presenting quite a complex set of ideas, because a health system is a complex system. And we're going to be proposing changes of different parts. So that's why we prepared this 10-page written statement. So at your leisure, before bedtime, that will be the best sleeping pill for you. And here, in the next 50 minutes, I'm going to only touch the highlights of this. And I have an able graduate student to help me to turn the slides. And I'm technology challenged. Next. I think the major problems confronting Vermont is well known to all of you. And I just want to highlight, besides the uninsured people, you have the PPACA Act passed by Congress will not solve the problem for you. You will reduce the number of uninsured from the projected roughly 50,000 people down to roughly 32,000. Still leave roughly 5% of Vermonters uninsured after the PPACA was implemented. And then, of course, you know 15% of Vermonters are underinsured. Undoubtedly, everyone in this room knows the strain of the healthcare costs on your pocketbooks or on your business. The cost escalation in Vermont will make your current system unsustainable. It's like a patient with hypertension. Initially, you might have hypertension, but you do not feel the symptoms. Then you begin to feel dizzy. And then eventually you will faint. You are at this point, in my view, you begin to feel the faint, but you have not collapsed yet. But as a system doctor, I can predict for you, you will faint. And also, the United States faced with the same set of problems. That's why in 5 years, I predict the United States will go through another major debate how to reform the healthcare system. The question for Vermont is, do you want to walk ahead of the United States? Do you want to be a model for the United States? Next. So we're asked to find the best way to fix the broken system. We were commissioned to do that. The Act 128 asked us to examine at least three alternatives, three options, which the speaker already mentioned. Let me just quickly refresh your memory. What are these three options? First, Act 128 asked us to examine and assess a government-run single-payer system. But in that, there are two alternatives. One is to cover in a comprehensive manner all the health services, including dental, vision care, beyond just medical, mental health, or drugs. But it's more than that. We were asked to also to examine whether we can cover nursing homes and home care. So that's called the comprehensive plan. Under option one, we are also asked to examine, to have a benefit package cover the essential services, which we define. These are the medical and the mental health services and the drugs that Vermonters on average are already enjoying. So in other words, nothing below what the typical Vermonters already have. Then Act 128 specified we should examine a public option offered through the insurance exchange. And third option is some option we believe may be most viable and practical. And we call this third option, which we will recommend to you, the public-private single-payer system. Next. The goals of Act 128, I think, are all familiar to you. I will not insult you by going through it, but there's a slide that summarizes it. The question then is, everybody use the word single payer. What does that mean? Single payer, I said in a public testimony, is like beauty. It's in the eyes of the beholder. And for our work, we have to define it much more precisely and exactly. So I offer you this definition. That's what we use in designing our recommendations and looking at different alternatives. It's a system that provides insurance to every Vermont resident with a common benefit package. That's part one. Second part is channel all the payments to the provider through a single pipe. Right now, you have many pipes paying hospitals, doctors, and other health professionals. A single payer will put all the payment and the claim adjudication into one pipe. So that's what we define single payer. We have done some analysis. So in other words, we did not just pull something out of thin air. And we understand very clearly what is the goal you want to achieve under Act 128. But how do you go from here to there? What challenges do you face? We found there are at least 15 hurdles you have to cross. And this picture represents a little bit what we have to do. This hiker is standing there and he wants to reach that mountaintop at a distance. He has to go into the forest and there might be bears and mountain lions. He has to cross some rivers that may even have crocodiles. He has to go around the pathway and cliffs of the mountains before he can reach the top. That's how we look at the job you commissioned me to do. And that 15 of them is listed in my written statement. I will not go into each one other than just quickly say, one is physical. Do you have the money to do what you want to do? Who is willing to pay for it? What are the legal barriers, including Medicare law, Medicaid law, the PPACA, and ERISA, the elephant in the room. And then also, the representatives and senators here, you represent different constituents. Each one is looking after their own interests, or their own beliefs. What's possible on the political landscape? And last but not least is, if you want to make something work, you need to understand how to operationalize it. You cannot just stream in the clouds. So we have to look at the operational capacity in Vermont. Then let me say this. We were so surprised and delighted that you, in Vermont, you have some very capable civil servants and public officials. And they're really dedicated. And it has been really a great pleasure for us to work with them. And so we're confident if you decide to pass legislation, your administration actually can execute it. So we examined the different alternatives and adopted the overall strategy. We looked at a different way. We did not only look at single payer. We looked at the single core model, which is a little bit like your HSA model. We look at the British National Health Service model. We look at the Canadian model. And we came to the conclusion the best strategy for you to achieve what Vermont wants to achieve is a single payer. But to achieve the single payer, you need funding. We concluded it is using a payroll contribution as the basis to fund the system that may be most viable and most practical. Now let me lead to the major 6 parameters from which we really guided us in our design. First is we will lock in and maximize the federal funds that will flow into Vermont. We do not want to do anything to jeopardize that. Second, there's no overall increase in health spending because in our stakeholder analysis, we heard from every group, business, labor unions, grassroots, public, they all say, we are spending enough for health care. It's taking away our spending for education, for environment, for creating jobs, or just to enjoy other